Welcome to Pharmacology case studies. These are very important for your licensing exams. The answer keys, their reasons will be present in the notes in the given link below for presentation. You can go and check it out. The first case study, which of the following best describes stable angina? Option A, angina occurs more frequently or with progressively less exercise or stress than before. No. Angina due to spasm of coronary arteries? No. Angina due to increased myocardial demand? Yes. Which is reproducible? Yes. And relieved by rest or nitroglycerin. So stable angina, it will be released by rest or nitroglycerin. So option C is correct here. Next, which medication should be prescribed to all angina patients to treat the acute attack? Isosorbate dinitrate, nitroglycerin patch, nitroglycerin sublingual, or spray ranolazine. The fast onset of action for sublingual tablet nitroglycerin is just 1 minute. The rest have more delayed onset, so we will, for emergency and acute attack, will prescribe nitroglycerin sublingual. Option C is correct. Then which of the following instruction is important to communicate to a patient receiving a prescription for nitroglycerin patch? Apply the patch at onset of angina symptoms for quick relief? No. Remove the old patch after 24 hours of use, then immediately apply the next patch? No. Do not use sublingual in combination with the patch. Have a nitrate free interval of 10 to 12 hours every day to prevent development of nitrate tolerance. This is a very important point. Nitrate free intervals will help prevent the development of nitrate tolerance. So sublingual nitroglycerin should be used to treat angina due to its quick onset. Transdermal have delayed onset of action. So here option D is correct, that we have to take nitrate free intervals. Next, a 64-year-old man was prescribed atenolol, sublingual nitroglycerin after his recent hospitalization for unstable angina. Which of his current medication should be discontinued? You see, these are all his current medications: sildenafil, amlodipine, metformin, lisinopril. And for unstable angina, when he is given nitroglycerin, so PDE5 inhibitors, that is sildenafil, they will interact and it will potentiate the vasodilator effect of nitroglycerin. So unsafe drop in BP will occur. They have drug interaction, not be taken together. So sildenafil, option A is correct. Which of the following correctly ranks the calcium channel blocker from most active on the myocardium to most peripherally active? So verapamil has most negative inotropic effects, nifedipine peripheral vasodilator, and diltiazem is intermediate. So we will select this B, option B, verapamil, then diltiazem intermediate, and nifedipine for periphery. Next, a 76-year-old man has uncontrolled hypertension, is experiencing typical angina pain, relief with stress, rest, and sublingual nitroglycerin. He has high BP and low heart rate. Blood pressure is high, hypertension, and bradycardia. What is the most appropriate therapy for this time? See, when you have to treat hypertension, among these, amlodipine is the best choice because it will improve angina, help in hypertension, and it will have no effect on heart rate. Verapamil and metoprolol, they will decrease heart rate more, and they should not be given when you have bradycardia. Ranolazine will help angina, but it has no effect on hypertension. So option D is correct. A 65-year-old male experiences uncontrolled angina attacks. That limit his ability to do household chores. He is adherent to a maximized dose of beta blocker with low heart rate and low BP. He is unable to tolerate an increase in isosorbate mononitrate due to headache. What is the most appropriate addition to antianginal therapy? You see, patient's BP is low. Verapamil and nifedipine, they will drop. So they are not a choice. Verapamil may also decrease heart rate. Ranolazine can be used with other agents when other agents are maximized, especially when BP is well controlled. So the patient will need a baseline ECG and lab work to ensure the safe use of medication, and here ranolazine will be the correct answer. A 62-year-old man with ischemic heart disease complains of angina pain which has been getting progressively worse over the past 30 minutes despite the use of nitroglycerin. Which of the following is best course of action? You see here there is an unstable angina and requires immediate evaluation, that is crescendo angina. So we have to initiate ranolazine. Option C is correct. Now, which is correct regarding antianginal therapy in patients with heart failure and reduce ejection fraction? We know beta blockers have been shown to reduce mortality in heart failure with reduced ejection fractions. Option A is correct. A 45-year-old woman with type 1 diabetes has been diagnosed with Prince metal angina. Which of the following is correct regarding management of angina in this patient? Prince metal or vasospastic angina, they will respond well to vasodilators including hydropyridine calcium channel blocker, that is felodipine. So verapamil, it is a weak vasodilator. Beta blockers may be used with caution in diabetic patients, but they are less effective for Prince metal. And nitrates are also effective, but Prince metal is provoked by coronary artery vasospasm, rather than physical activities. So here option D is correct, that felodipine. Thank you.